In our changing world, there's a real need to access virtual healthcare. And today at Sun Life, we're leading the industry with virtual care innovations. Lumino Health Virtual Care, powered by Dialogue, lets employees and their family members connect with healthcare professionals online and receive a diagnosis and treatment for physical or mental health concerns. Online cognitive behavioral therapy and virtual paramedical services also provide effective treatment from the comfort of home, eliminating travel, reducing wait times, and helping Canadians get back to feeling their best faster. Learn more about Sun Life's virtual healthcare solutions.
So let's start with the elephant in the room, which is COVID-19. So it's upended, the economy pretty much in every sector you can think of in a way that none of us have seen in our lifetime. So Frank, I'm going to start out with you, if you don't mind today, to kind of look at what are some of the issues facing small employers and how have benefit plan providers kind of responded to this pandemic?
Sure, thanks, Todd. Yeah, everyone, I think we can actually say everyone's been impacted by COVID-19, and it's really created unprecedented socioeconomic and health challenges for both employers, business owners, and their employees. And we're really living through very challenging times because it's not only a question of having employees in lockdown, which was something that really we haven't seen on such a large scale like that. But now as lockdowns ease, even though we have a threat of a second wave, but as they ease, it's really merging sort of that work between being able to go back with all the restrictions that the government are putting in place. You have a lot of employees that have to juggle not only their work responsibilities, but also maybe caring for a loved one and kids going back to school. So you really have a lot of challenges going on at the same time. And for small business owners, I mean, a lot of them are, wear multiple hats, right? So they're the business owners. Sometimes they're a little bit of the HR person. They're in charge of marketing and sales. So they're really involved quite a bit. So their focus has really been on keeping the doors open, but also managing and really responding to all the challenges that their employees are facing. So as an insurer, it was really all about providing just-in-time support for our plan sponsors and our clients. And a couple of things that we did to approach that on the financial side, for example, is really providing some financial relief. So we looked at, flexible premium payment options. Can we defer payments by a little bit just to help them out and cash flow? We also provided premium credits. So because of a lot of the lockdowns, a lot of services that employees would typically use, such as from dental service providers or paramedical services, they weren't being offered. So those credits, or if you will, those claims will actually funneled back to plan sponsors as premium credits. So that's the financial component. We also look at easing some of the administrative services. So for example, employees that were, in lockdown back at home, but employers that wanted to keep up their benefits, we were able to extend a lot of the benefits for these folks, even though the employees were on reduced hours or in some cases, not working at all. So really it was providing a lot of support for clients, for the advisors, and really helping them manage through this period. And it was really important to adapt very quickly. So what we did is we also created a website really specific for COVID-19 for both our sponsors and advisors, because information was, especially at the beginning, I think back in March and April, information was really coming fast and furious and changing quite rapidly. So we wanted to create really a resource center for folks to be able to really get that information just in time, but also very specific to their province or their territory.
Great. Patrick, what are your thoughts on COVID-19 and what it's done to organizations?
Well, I think, first of all, the insurance companies reacted very well to COVID-19. I think we were all in the same situation where we didn't know what the future held. So you were it was changing every week, every 2 weeks, and because the insurance company were receptive, because all this was not covered in contracts, the written contracts we had with our clients. We had to go outside the box and think about how we could answer their needs. Some decided, some really didn't have any money to continue paying premiums, so they just suspended their benefits for a month or 2 months, 3 months, and were allowed to get them going again without any penalties or anything. Some took more than 60, 90 days to pay us, okay? So I think it was, it showed the community came together to answer the call. It was a weird time to live through. Now, if there is a second wave, there probably is going to be one. It's going to be easier because we know what we're facing to a certain extent. But in March and April, it was fast and furious, and the governments were changing their plans. The insurance companies had to adapt. We had to adapt. And for a certain period of time, the employers were a little in the dark, wondering what they were going to do with their employees. And so it's nice to see that we all came together and we got through it.
And Dominica, what about you at your what have you seen related to the pandemic play out?
So we actually were in a very interesting position because even though we were in lockdown, none of our work really slowed down. And as soon as some of the restrictions were being lifted, we hired a great number of employees. So we experienced the pandemic from a different perspective, where we had to onboard people without actually having all of the answers and hope that everything worked out. So even though it's a huge struggle and there were a lot of people who didn't quite know exactly what was happening, having the support from our benefits providers really helped us, because we were able to provide our employees with at least some answers and let them know that they would have coverage.
Perfect. Okay. Patrick, pose this question to you. So what are you seeing in the market in terms of what small business owners are looking for and asking for when it comes to benefit plans?
I think you can pretty well split them up in two. The ones that already have insurance tend to want exactly what they already have, okay? Even though you try to educate them on what's out there, cost effective options, it's hard for a small business owner, because the small business owner, like Frank was saying, is often the HR person. And they're usually very busy, and they don't have time to get more information about the cost-effective solutions. And the easiest way for them is just to duplicate what they already have. At that time, there's no questions from the employees. There's no decline claims from the employees, so it's easier for them. On the other side, when you look at a group that doesn't have any insurance, they trust their advisor to give them what's out there. And it's easier at that time to come in with a cost-effective options, because they don't know what's out there. They've never had insurance. So the employees, they don't see a break in the coverage. And often it's our job to educate them and try to get them to take cost-effective plans that will help them in the long run.
Sure. And Frank, I see you nodding there. What are your thoughts there?
Yeah, absolutely. And it's interesting enough, Sun Life partnered with Ipsos for a survey of Canadian plan sponsors that do offer group benefits. And it's interesting to take to Patrick's point, but really benefits has become really a tool of attraction and retention for employees. And it's particularly important for the small business side. The survey showed that about 53% really look at a benefits program to attract and retain staff. And I laugh because I think of, the pandemic has created so many challenges for plan sponsors at the beginning. So the lockdowns and really retooling their business, figuring out how they can keep the doors open. And then when they did, a lot of them had shifted what they were producing to a different demand within COVID, and then looking to hire employees. So it was really interesting to Dominica's point that they were, the pandemic actually drove an increase there. And then some of the programs that were put in place were actually hindering, looking for these individuals, because folks, the challenges of health and do I really want to go back to work, but I have the security that's provided by the government. So there's a lot of challenging times there. But clearly, the benefits program is there to attract and retain talent. What we're seeing in the marketplace is employers and employees are looking for a little bit more flexibility. So of course when the challenges with small businesses, you can't come up with a cafeteria style plan or offer too much flexibility because of underwriting guidelines and everything that goes with that. But there is ways of adding some flexibility into plans. And I'm thinking of healthcare spending accounts and personal spending accounts where employers can provide some funds to the employees, and they feel more empowered to be able to spend their benefit dollars on items that they find the most attractive. So that we're seeing a lot more of a push for healthcare and personal spending accounts. And one fact that really struck me from the survey is 67% of employees would actually prefer to keep their benefits plan over a $5,000 increase in salary. I found that pretty striking. So we really see the importance of benefits as their overall total benefits program.
Yeah, that is a striking number. I mean, a lot of people would say, I'd love a $5,000 raise, but not the cost of losing benefits, clearly. Dominica.
We didn't survey both. Sorry,
yep.
I was just going to say we didn't survey both, so I'm pretty sure they would like benefits and the 5,000, but that wasn't part of the survey.
Yeah, and Dominica, one thing that Frank said that was interesting that we often hear about is that benefits will often make a big decision for employees when making a decision to join an organization or even stay. So has that been your experience when you're looking, at staff? Is that a make or break decision, the level of benefits?
Absolutely, and we have several different, even though we're a very small company, there are different requirements. We have several employees who are on single coverage, and that was one of their initial questions when they were considering us as an employer is, do we have benefits coverage? We have several employees who have families with young children, and again, that was something that they asked about. So it absolutely makes a difference, and being able to provide benefits, even though they may not be as flexible as some of the larger corporations, it really plays into a decision about employment. And the ability to offer benefits Canada-wide has been a very, very important thing for us, as well as we have several employees who are remote. So that has been a very big thing in their decision to join our team.
So benefits are an investment in your people, in your organization, of course, right? So with so many companies, as we know, watching budgets very tightly, what are some kind of tips and tactics that they can use to manage the costs of their benefit programs?
Yeah, employers are certainly looking to provide more with budgets that they have. They're looking certainly beyond the one-size-fits-all benefits plan, so they do want some flexibility, as I was mentioning before. There's a lot of solutions out there in the market. We talked about healthcare spending account. Personal spending accounts are really taking up a lot more speed, so it's a way for employers to manage their costs because it's more of a fixed type of cost, and it does provide a lot more flexibility for plan members because, again, you could allocate or spend the benefit dollars to where what's most important to you. And a lot of the solutions are digital now, so it really allows employees to make more, spend the dollar where I want, and I could actually have that I'll call it the Amazon shopping experience where they could look through digital benefit providers and be able to spend their dollars there. I'd say one other challenge that we have, and we don't speak about this too much in the benefits because we have a tendency of just looking at the premium and the claims dollars spent, but a lot of the cost that's associated with the premium that we pay is the actually administration piece of it. So the time spent by employers in managing their benefits plan, if we could help reduce that, then overall that not only frees up the hard dollars that are associated to managing the plan, but the what I call the soft dollars or the indirect cost savings by having an HR person or a business owner spend less time in managing their plans. And a lot of that, some of the solutions that are available or used to be available were really not scalable. So they were really good when an employer had an HR department, and they could leverage some of those tools. But when it actually came down to smaller enterprises, it could rarely be scaled. That's changed quite a bit now with the advent of technology. A lot of more cloud-based solutions that are available. I think of some of the solutions that we have at Sun Life that we partner with some firms around that. So it's really focusing more on HR, digital administration tools, simplified enrollment. So as opposed to managing paper when you're enrolling a new employee in a plan or making changes to the plan, it's really pushing out the digital solutions to the employee's smartphone. They could do their enrollment, designate their beneficiary, make changes as they go along. And because everything is cloud-based and really digital, everything is uploaded to billing. So it simplifies a lot more the administration for the plan sponsor. And I think that's one piece that we really like to look at more at getting not only advisors but plan sponsors looking into, because there are some cost savings that they could see there.
Sure. And Frank, just a follow-up question on that. What's the take up like among, when a plan sponsor rolls this out for their teams? Do the employees welcome this kind of flexibility and welcome this kind of self-serve model, or is there an education piece that has to be done?
The uptake is quite it's much better, and I think we can't underestimate the power of the smartphone. A lot of folks, traditionally we would think the white collar employees would be much more comfortable with technology, but the reality with smartphones now, a lot of folks have them. I think over 70% of the population has access to that. So they are comfortable, and actually they're welcoming it. And that's what we see in a lot of our surveys is employees they want the Amazon-like experience in everything that they do, and that includes their benefits program. So I think we can't be shy to be able to leverage that and use it, and the approval of it is quite high regarding plan members. So there is some education that goes with it. Just like with any change, there's a bit of change management, but the change is quite welcome from plan members. And a lot of plan sponsors that have gone through that, they really wonder why didn't they do it sooner.
Okay, and Patrick, when you get this question about how we can reduce costs, what do you say? What's your answer?
Well, one of the things we do is instead of reducing costs, is making sure that we've got the right plan for the right company. Like I said, when you have a group that's not insured, we try to encourage them to go with a simpler plan, because nobody knows how much the employees are going to claim. If you look at these days, there's a lot of people that are active, that are working, that are taking very expensive medication for different conditions. Nobody knows they're sick, and you never know what the dependents' health issues are. So we always tell the employer, start slow. It's always easier to add next year and 2 years than to take away. Taking away stuff from the employees is not easy. So we encourage them to start slow and to see the difference between, there's catastrophic insurance where you have to have it, and there's more budget items like dental, masseurs, vision care, where we tend to tell them to go slow. And we talk to them about the alternatives like health spending accounts, where you give everybody a certain amount, and it's very cost effective tax-wise, because instead of giving them $1,000 increase and they have to pay taxes, you give them $1,000 health spending account, and it's tax-free. So it's pushing that kind of stuff with them. But again, once they've got insurance, it's hard to get them to move over to a health spending account. It's more about education, communication with the employee, and often the employers don't have the time to do that kind of stuff.
Great, thanks, Patrick. And Dominica, what's been your experience when it comes to trying to maintain costs and ensure that your employees have what they need?
Having everything available online has been the biggest impact on us. Having an app that you can use on a phone has been very well received, and that's something that we definitely look for when we look at changing or upgrading a plan. That is something that our employees absolutely want to see, and the fact that they can manage their own account is a huge saving for me, because then I don't have to deal with paperwork. So that's something that is a very impactful thing. And any more information, having tutorials online, having the ability to ask questions directly to the plan, whether it's a chat option or an email, and something like that. That has been a very impactful thing for us as employers and as employees.
That's great. And you sort of touched on this already, Dominica, but the next kind of topic we're going to look at is what solutions are small businesses looking for when it comes to coverage, and what are you looking for from a provider to help you put the best package in front of your teams?
So cost is obviously the biggest thing. We have to be able to provide even though it's an incentive and we see it as a retention for employees, it's a great tool for that. It's still a cost to the business. So that is, for a small business, a very big thing. So even though we're a small team and we want to have the flexibility of being able to offer all kinds of benefits, being able to decide on each one independently, so kind of like a pick and choose model, that really helps, because then we can offer benefits and not necessarily offer the same kind of benefits as a larger organization would, but still be able to support our employees. And we do have a diverse group, even though we're a small group with diverse needs, and some of them need single insurance, some of them need insurance for dependents. So having the flexibility of being able to offer that is something that we look at. And of course, being the plan administrator, I look for support. So what kind of support do you offer for the administrators? What kind of support do you offer for the employees? Are there training videos? Are there manuals? How do we get to find out who to talk to? Who do we reach out to? Those are all key things.
Great. And Frank, what type of support does a company like Sun Life offer to the plan sponsors?
Mm-hmm. Yeah, no, we certainly we have our client service agents that are available to really support plan sponsors, particularly in small business, like I mentioned before, where you have a person that really handles pretty much all the questions. In a small business like that, there's a lot more proximity between the employees and their HR or employer. So we want to make sure that we have the support through our CSAs that are able to provide real-time, just-in-time responses to our clients. One thing that I think it's really important that we have to look at and continue to look at. So to Dominica's point, employees are looking for flexibility, and you try to do that within a very specific envelope of cost. But there's ways to do it differently that you could drive appreciation of the plan without putting necessarily more dollars. For example, if I look at Lumino Health, which is Canada's largest network of health providers that's managed through Sun Life. Again, just using the tool to be able to put a whole network of providers, relevant content, discounts, anything that could leverage being a client of Sun Life that could benefit your or the employees or the plan members is really important for us. So, and that's how we drive more value to the plan without necessarily adding costs. More and more, we need to look at that, because the access is one thing, but employees are really looking for telehealth. So, we talk about telemedicine, virtual care, access to a physician. So more and more, these services will be prominent. I think they showed the relevancy during COVID, but the convenience of it, I think, is going to be that lingering effect. So Lumino Virtual Healthcare that we offer through, for example, our small business in partnership with Dialogue is also a great way that we add value to the plan without necessarily increasing costs for the plan sponsors. So more information like that, more access to digital platforms, digital services is where we think employers and employees are looking for.
For sure. And I think a lot of the conversation we've had so far, we're kind of weighing the cost of the benefits versus the, pardon the pun, but the benefit to the employees, and making sure that the value there is there. So Patrick, that's one of the questions we want to talk about as well today, is is how can you kind of reconcile what a small business owner is looking for in a benefits plan versus what they can afford to pay for their workers?
Well, I think for one of the first thing we have to do is remember that a lot of employees don't know how much insurance costs. Most employers are paying at least 50% of the cost, and it's a little like healthcare in Canada. Unless you go on a trip down south and you break a leg and you have no idea how much it's costing. And it's always surprising to see how expensive it is. It's the same for healthcare. When employees look at what they're paying, they don't realize that often the cost is twice as much as what they're paying. And it's important, I think, for employers to be able to show the employees at least once a year how much they're contributing towards these benefits. And I think that at that time, the employee appreciates it a little better because he realizes that the employer is really putting in money, and it's like having like we said, a salary increase, and even better because the salary increase would be taxable, whereas this is non-taxable. So it's worth a lot of money to the employees, and the employees can appreciate it much better. And it's like with stuff like if Frank was talking about telemedicine, it's a great way to reduce cost for the employee and for the employer. Instead of sitting in a clinic and waiting 4 or 5 hours to be seen, and you have to take a sick day, you can just call in it from your desk at work, and often the problem is solved pretty fast. So it's with that kind of additional options, the employees appreciate it a lot, and it's surprising it's not that expensive, and it's the employees see the value of it, and the employer also, because I would imagine it's going to reduce the absenteeism because employees, instead of staying home, are going to end up going to work more.
Sure. And what's the uptake right now on telemedicine and that kind of virtual healthcare space? Are we seeing a lot of employers opt for that coverage?
I think the insurance companies are pushing it quite a bit. Some are offering it in their plans, building it into their underwriting, because everybody sees it as a very value-added feature. And the employers, the minute the employees get it and they try it, they don't want to lose that anymore. Let's face it, it's so much easier, and you look at the way it is in Canada. I'm in Quebec, and if you go to the hospital, you're going to wait 7-8 hours before you get to the triage nurse. Like, it doesn't make sense. So it's the employees are appreciating it a lot, and the insurance companies are really pushing it, and we're starting to see a lot of uptake. And maybe Frank can talk to it. You would have more information than I am.
Yeah, definitely, Patrick, you're absolutely right. We do see an increase, a lot of interest. In fact, it's a standard offering in our what we call our Sun Advantage segment, which is groups of 50 employees or less. So that's an automatic offering that we have. But even on our larger group, we are seeing a lot of uptake. At the beginning, it was a little sort of, I would say, clients were really weighing the additional cost versus all the unknowns happening with COVID. But now, as we're getting sort of back to our certain normalcy, we're really starting to see a lot of interest from our plan sponsors. And to Patrick's point, they're seeing that advantage because they figure, if I could keep my employee healthy and productive, and really minimize the disruption and time for those virtual consultations, then it's really an investment that will pay off. Maybe not immediately, but certainly we'll start seeing those effects on absenteeism and disability management.
Sure. And Dominica, just to follow up on that, and not to put you on the spot here, but when you're looking at a benefit, let's say you're looking at virtual healthcare as an option, do you take into account all of the do you look at the cost of it, or do you also look at the cost of it in terms of, your employees have to take the afternoon off to go to the doctor, or potentially take a full day off to do whatever? Is that factored into your thinking when you're looking at the cost of a program?
Absolutely, it is. And it's something that we have a discussion about at the management level. And when we look at benefits, it's definitely something that I would present as an option to management so that they can they have all the options available to them, and they can make a decision based on that. But it's definitely a consideration, because time away from work is not a good thing.
No, for sure. And I think too, one of the things, with benefit plans that employees, and Patrick, you kind of touched on this, is that they don't know the cost of things. They don't always value what is on the table for them until they have to use it, right? So what's the best way, or what are some of the good ways that you've seen plan sponsors communicate to their workers about the value of the benefits so they truly understand that investment?
Well, first of all, we were talking about like telemedicine. Often the employees don't see the value of the plan when you're talking about life insurance or disability unless they become disabled. So it's not as concrete as coverage, okay? Like, it's very abstract. When you get into options like telemedicine, where most people are going to use it, then you, even though it's not that expensive, I think it's going to make the satisfaction of the employees go up, because they're using the plan. And often people that aren't that sick or aren't taking medication feel chipped to a certain extent, because they say, I'm not taking the plan and I'm paying premiums. So this is one way to make it go up, make satisfaction go up. The other way is, I think it's important to be able to communicate to the employees how much the plan is costing, how much once a year. With the salary increases, we're talking about more HR here. With a salary increase, when you talk about this employee salaries, it's not 50,000, it's 50,000 plus how much I'm paying for your benefits to a certain extent. That's what we try to encourage employers to do is, instead of paying, let's say, for 50% of the benefits, we encourage them to go on a percentage of salary. If you can give them, let's say, 4% of their benefits of their salary towards benefits, it's much easier to do that when you present. You have the yearly meeting to talk about salaries and everything. It's much easier to do, and you get away from that old way of doing it, whereas I'm going to pay 50% of your benefits. If you're married, I'm going to pay more than if you're single. Like, it's an old way of seeing things. Whereas with you base it on the salary, it's an easier presentation.
That's a good point, Patrick. And one thing, Todd, that I would add to that is certainly education and communication. So a lot of employees don't know sort of the information or even the tools that they can access, even within their own benefits plan. So, the pandemic certainly has driven a lot of telemedicine. So virtual care, the consultation with physicians, is probably the most prominent one. But a lot of other paramedical service providers do offer virtual care. So you could still see a psychologist and do online therapy. There's even chiropractors and physiotherapists that do online therapies as well. So that's one way that to continue to access their benefit, but perhaps employees don't know that they have access to that information. So education, the opportunity to really present these benefits directly to the plan members, either through webinars or when employers can sponsor sort of virtual sessions like this, education sessions where the insurance carrier can provide that information, or through digital tools that for example, certain carriers have, where a digital benefits assistant will be able to take the data and claims information and be able to guide employees. For example, if an employee is claimed for a prescription drug and it's a brand name drug, and there is a generic alternative, the system will actually tell them, you submitted your claim, here's your reimbursement. By the way, did you know you could also, claim next time for a generic and probably have less out of pocket. So it's really important to be able to leverage and educate plan members on this information. We do this every day, but employees are maybe not aware of everything that's available.
Right.
To a certain extent, what happens when you're not careful is the plan design starts driving the need of services. If you look at vision care, when you don't have vision care, you change your glasses every 4 or 5 years. But because you have a plan that says you're covered, if you change them every 24 months, all of a sudden everybody's changing their glasses every 24 months. Dental plans with a 6-month recall. I don't know who invented the 6-month recall, but all of a sudden everybody's recommending that you see the dentist twice a year, but it's not necessary for everybody. Some people can go once a year. Other people should maybe going every 3 months. But the plan design is driving it, and I think it's important to try to make the employees aware of that, so they don't get into that. The dentist calling, and I have to go see the dentist for a dental recall, and I go even though I don't feel I need it. So it's a lot about education, I think.
Sure. And Dominica, what do you do with your teams and your staff at your organization? How do you communicate the value of the benefits investment?
So this is something that we haven't done a whole lot of. Our team is fairly new, so they obviously have benefits and have coverage. This falls on me to communicate what their coverage is and to ensure that they know that they have different things available to them. And it's something that I'm working towards offering on a regular basis, where I would send them a short note or have a call-in webinar or something like that, or sit around the coffee table and just remind people, by the way, you have benefits, please use them.
Perfect, great. All right, so we started out today's conversation talking about COVID. We're going to come back there a little bit here towards the end, and that's when we talk about mental health. Mental health, of course, has been a massive issue, not just this year. Well, mental health has always been an issue, but it's come to the forefront in the last 5 to 10 years for employers, getting more recognition as an issue as the stigma comes away. And we know that through the pandemic, we've seen a lot of challenges. We've seen spikes, in certain claims, activity, prescriptions, all those kinds of things. We've got lots of anecdotal evidence. So, Dominique, I'm kind of curious, mental health, what can be done in an organization to help workers who are struggling through the pandemic with, being at home and childcare and just feeling overwhelmed with things?
I find this to be a very personal issue. I have a lot of family members who have struggled throughout the years with many different things, and finding support is sometimes a challenge. I think being an employer who is a small team, it's sometimes difficult for people to come forward and tell that they have a challenge that they want to address. So from a personal perspective, one of my family members was misusing alcohol for quite some time. I had to take some time off, and I was very fortunate that my manager was open to that. But it was a difficult conversation to have, to come and tell my manager directly what was happening, and to try to protect privacy, but at the same time be open enough to have them understand why I needed time away. So I think it would be amazing to have some kind of support for employees that doesn't come directly through the employer. Perhaps it's something that they could access directly through the provider and not necessarily have to be so open. I think a lot of people struggle with understanding and with trying to figure out how to approach this. I'm very happy that the stigma in our society around mental health is declining, that we're doing some hard work on making sure that that people understand that this is an illness and not something to be ashamed of. So I'm very hopeful that this is something that will continue to get better. But in the meantime, to have some services available to employees that they can access that doesn't involve management, I think that would be very helpful.
For sure. And Frank, from your perspective, what are some of the things that are on the table that can help employees going through this?
Mm-hmm. Yeah, and certainly the key to an employee's well-being is good mental health, and it's everyone's responsibility, the employers, the advisors, the employees themselves, and of course the providers, to really be able to not only just foster an environment where they feel comfortable to be able to access this information. So you could create so many wonderful services and opportunities and make them digital and available. But if employees don't feel, first of all, they don't know that they exist or don't feel comfortable to be able to access them, then they're really not driving what we're looking for. So fostering an environment is really, really important, and that does go through education, support that we could provide and not only we as insurance providers, but advisors as well, support that we could provide employers on good practices, how they can support their employees, and also educating the employees on the services that are out there. Some studies show 60% of Canadians with a mental health condition aren't using their benefits, and yet many of them do have great resources available. So that's, for us, the first start is really to educate, and then it's really leveraging the services that are available. So there's the employee assistance program that's usually that first step to get going. There's wellness resources. I mentioned Lumino Health Center before, where the employee in their own comfort, taking sort of their mental health in their own hands to be able to access information and services really based on their own comfort level. And there's some services that exist within the benefits program that's available. I'm thinking of online cognitive behavioral therapy that can now, there's really for those that, can't access services, they can do it from the comfort of their own home. So that's really leveraging some of the digital tools now to be able to support employees in their mental health. But it really starts by creating a great environment where they feel that they can access that.
Sure. And Patrick, again, over to you. What are you seeing when it comes to mental health? What are people asking for, and what solutions have you seen that work well?
Well, one of the things that we encourage our groups to take is employee assistance programs. An employee assistance program is completely confidential. The employees can call. It's not the insurance company. They have somebody else doing it for them. And the employer never gets to know who called or what they talked about. And once the employees know that it is completely confidential, and they can call somebody who's specialized in different conditions, okay, who will listen and help them get the help they need. I think that's first step towards also helping the employer on absenteeism. If you can reduce, if you can catch these things early on, where they don't, and instead of waiting until they're disabled, it's much better, right? If they get out right away. For sure, COVID has been a big strain because a lot of conditions are worsened with stress. What we've done as an employer, we were lucky because we were able to assure all the employees that they would keep their jobs. And but a lot of employers weren't in that position where they had to. The employees were wondering, how long am I gonna have my job for? Am I gonna have benefits? And I'm sure it's played a big role in the mental issues that have come up during COVID. That uncertainty, that stress, it's not a good combination, right?
Perfect. Okay. So that's the end of our kind of questions now. Now we've got the opportunity just for kind of the closing remarks. So Frank, why don't we start with you, just in terms of getting you to kind of sum up your thoughts today on our conversation and what small business owners can offer their employees.
Mm-hmm. Yeah, as the world adjusts to sort of the new normal, I think small and medium businesses really need to be more nimble, especially with their benefits plan, their administration tools, to really set them up for the success in this new normal. And really, I feel positive. I'm going to take a really positive spin on this. COVID's got certainly a lot of drawbacks in very sad situation it's created in the world. It is a health crisis, but of that, there is some opportunities, and I think the buy local is really going to help small and medium businesses, across Canada. And I think having a good benefits plan, a good program to be able to support employees in small business will help us, drive the economy and drive small business forward. One thing that I think we really need to focus on is continue to have those digital customizable tools, really leveraging the solutions that are available now that are much more affordable and sort of really can assist small businesses in maintaining an efficient approach to managing their benefits plan, but also keeps their business running at maximum capacity. Employers need to have attractive plans to really retain good talent, attract and retain good talent. But it doesn't have to be that full, cafeteria style flexible plan. Sometimes it's just tweaks and really taking the time with the advisor to look at, sort of where the business at, where they need to go, and how they could sort of adjust their benefits plan. Even if you add some flexibility through a healthcare spending account or personal spending account, and really a focus on mental well-being, I think is going to be really, really important. And again, it's not just the employers and employees who need to address the needs. I think advisors play a big role in this to really partner and support their clients and really align with the right provider, because it's cost is extremely important. But one thing that's really important in benefits plan is value. So, how much can you actually get out of your benefits plan to make sure you're really maximizing the returns you expect, not only financially, but for your employees as well.
Great, thank you, Frank. Patrick, you're up.
I think what we've seen today is that we have to focus a lot more on communication and education. And like Frank said, COVID is, I think, pushing us into the digital age much faster than we were going before. And we're never going to go back to the way it was. And a lot of employers now have portals like Lumino Health for the employees. So we can start coming up with all kinds of webinars to educate the employees and communications. We tended to think of communication as paper. We don't have to think that way anymore. And through a digital presence, we don't have to go through, the employer doesn't have to be involved anymore like it used to be. We used to, typically group insurance, you had to talk to the employer, give them documents that they gave the employees. Now it's another reality. If the employer agrees, you go around the employee, you go straight to the employees to educate them, to make them more aware of the cost of benefits, to make them aware of the cost-effective solutions. So I think it's COVID has been good in that way, in that it's pushing really the industry into the digital age, and it's an industry that's not easy to move, let's say. So we're going in a right direction. It's a little like working from home. We're never going to go back to what it was. Nobody's going to want to go back to work 5 days a week anymore. That's for sure. So it's not bad, but we're going to adapt. And I think if we're smart, we're going to adapt for the better and come up with digital solutions to communicate and educate employees and employers.
Great, thank you, Patrick. And Dominica?
So I think that it's been a challenging time with COVID. It's definitely shown us how we can shine better. We are incredibly proud of the fact that we offer benefits, even though we are a very small company. It's something that we're happy that our employees use, and we're happy that our employees look for when they're looking to see if they will join our organization. And that's something that we're very proud of. Looking forward, I think that being able to offer digital solutions is something that is going to, like Patrick said, be the new normal. And being able to meet around the water cooler is not going to be the same thing anymore. So we are looking forward to how our world changes and how we could change with it.